And now to help us understand the re-emergence of polio in the country, we are joined this morning by the World Health Organization representative in the Philippines, Dr. Rabindra Abeyasinghe. Good morning and thank you for joining us once again here on New Day.
Morning, Freddie. Pleasure to be here.
Now, let's first get the notion through that the Philippines was declared polio-free back in 2000. And
that's correct.
Right now, it has reemerged once again after a few months or so. How could this have happened?
So, certification of a polio-free status depends on the absence of the wild polio virus.
Okay.
So, let me be clear that what we have is not the detection of the wild polio virus. What we have confirmed in the Philippines is what we call a vaccine-derived polio strain.
Okay, so, since you mentioned this was a vaccine-derived polio strain, could you explain further about this?
So, let me start with what is polio. Polio is a viral disease, and we don't have treatment for people who get polio. What we have is a prevention, and there's two types of vaccines. One is the oral polio vaccine, which actually has a virus, a mix of viruses, which have lost their ability to cause disease, right?
Okay.
Because they've been changed, but they can still stimulate immunity in people.
Right.
The other one is a mixture of killed viruses, which gives you immunity.
That's an injectable form.
Yeah.
Okay.
So a vaccine-derived polio outbreak happens when the oral polio vaccine is administered. What usually would happen is that the viruses would multiply in the gut and give protection to the person, the child getting the vaccine.
Okay.
But they also in the process excrete the virus. And that virus then serves as, because other kids get infected with that, it protects even a few kids who have not got the vaccine.
Okay.
But the idea is that you need to reach 95% coverage with the oral polio vaccine, because then the infection of other kids will die out in 3 to 4 weeks. And the polio virus will disappear from the environment. Okay. What happens is when you have very poor vaccine coverage, the virus can continue to spread among unimmunized children for many years. And in that process, that inactivated virus acquires the ability to cause disease again.
Okay.
So that's what we're seeing here.
So one of the reasons, again, could be because of poor coverage, poor vaccine coverage.
Definitely,
of children.
yes.
Now, the first case in about 2 decades was reported in Lanao del Sur, and then there was one again in Laguna, and also in the waterways of Manila and Davao. Now, for the benefit of our viewers, could you tell us exactly how is polio transmitted? How does one get infected with polio?
So as I already mentioned, the transmission of polio happens by what we call in medical circles fecal-oral transmission. What that means is the virus is contained in feces or excreta, and when that contaminates water and people consume that water or fresh food containing that water or uncooked food, people could acquire the virus and become infected.
Okay. Now, there are 3 types of polio viruses. There are 3 strains. There's 1, 2, and 3. But what was reported that was out, or what was infecting people, was type 2. Could you explain to us the differences of these types?
WHO remains very concerned with the situation in the Philippines because what was detected was vaccine-derived polio type 2. So let me explain that. The type 2 wild polio virus was eradicated globally in 2015. So I mentioned the mix in the oral polio vaccines.
Right.
So it was decided that there is no longer a need to include type 2 in the oral polio vaccine. And so what we have now is an oral polio vaccine which protects against type 1 and type 3. But what we found here, and that happened globally in 2016. So basically from 2016, the children in the Philippines are not being protected against type 2, except those few kids who get the intramuscular eye injection for polio virus. But so what we've seen here now is a type 2 vaccine-derived virus. So what that means is that this virus has been in the environment since sometime before 2015.
Okay.
right? And that's why we are alarmed, because we are very conscious of the fact that a large proportion of children in the Philippines have no protection against type 2.
Okay. Now, when you say that the type 2 virus is the one that you found, this was mutated. My understanding is it mutated, it changed. Now that the type 2 has changed, will the current vaccines for the type 2 still be effective?
No. So the IPV vaccine is effective against type 2.
Okay.
But to prevent an outbreak, you need to use the oral polio vaccine, because you need to create the ability to interrupt the transmission. For that reason, as I said, the current oral polio vaccine doesn't protect against type 2.
Right.
But WHO has a special stockpile of type 2 oral polio vaccines, which are used in situations like this.
Which will be coming here to the Philippines?
That's the plan, yeah.
Okay.
So we have emergency provisions to bring in the vaccine.
So as of now, currently, it is not yet here, but we have plans.
It's on the way. The request has gone from the Department of Health to WHO. The DG will approve it and release the vaccine stocks for the Philippines.
Okay, so as of now, what can parents do in order to protect their children and protect themselves as well?
So another reason why we are concerned is also in the waterways of Manila, we also detected type 1 viruses.
Okay.
Right? So it's a complicated situation, and because of this, we are urging parents and caregivers and health workers to ensure that every child under 5 years completes the immunization schedule. And I mean the 3 oral polio vaccines at 1.5, 2.5, and 3.5 months, and the IPV vaccine at 3.5 months.
Okay.
The importance being IPV will give you some protection for type 2, right? But what we have is that the coverage is very poor. So for the 3 oral polio vaccines, we have coverage like 65%. And for the IPV, it's like 40%. Okay. So we need to radically raise that up and protect all the children. So the idea is that right now, because we confirmed isolation of the viruses in environmental samples, as you said, in Davao and Manila.
Right.
But we don't know where else it's circulating, because the virus can move very fast. So our advice is parents, caregivers, health workers, please ensure that all children under 5 years complete the whole immunization schedule for polio.
Okay. I think it's clear that to stress the importance of vaccinating children below 5 years old. But doctor, what about the adults? What about the adults who aren't sure if they had a polio vaccine when they were kids, or what if they're thinking about trying to protect themselves from the polio virus? Should they get a booster dose, or should they get a dose of the polio vaccine as well?
It's a good question, because we don't normally recommend. It's assumed that most adults have acquired immunity either by getting the vaccines or being exposed to people who had the vaccine and they have acquired the immunity, as I explained before.
Right.
But we still recommend that particular people who are at higher risks need to get a booster dose. And that could be health workers who are dealing with patients.
Those who are exposed to the virus more often.
Yeah, and the same applies to travelers, because if you're in an area where an outbreak has been detected and you're planning to travel to another country, it's recommended that you take a booster dose.
Okay.
And the reverse of, if you're coming into the Philippines and you have completed your doses more than 12 years ago, it's recommended that you get a booster dose.
Okay. Now, for the adults, are there any symptoms of polio for those adults that are infected?
See, the symptoms of polio are very general. So when kids get infected, most of them will have a very light fever, headache, sometimes a diarrhea. And
so
a sore throat.
very
generalized symptoms.
features.
It's only 1 in 200 of the kids who get infected will actually get paralysis or weakness of the limbs. And 10 out of those kids could die because the polio affects your breathing, and you die from your breathing stopping.
Okay. So thank you very much, Dr. Rabindra Abeyasinghe, for joining us. He is the Philippines representative for the WHO. One quick question before we go. Is the Philippines ready or doing any measures for this type of epidemic? Maybe possible to contain, can we contain a possible outbreak of polio?
So you've done this before, so this is not something new. You had a vaccine-derived polio outbreak in 2001. Right now we are seeing good commitment from the Department of Health and the government, and we as international partners, the WHO, UNICEF, other partners, the Global Polio Eradication Initiative, and all its partners stand behind the government of the Philippines to help you mount a good response.
Okay. Thank you very much again, Dr. Rabindra Abeyasinghe, for joining us and sharing your knowledge and giving us more information about that.